Hello everyone, I'm Daz, and this week's discussion is about an interesting article that I came across linking COVID, especially Omicron, to sleep paralysis. So we're going to talk about this after a message from our sponsor.
Friends, the time to prepare for bad times is during good times. If you know a big storm is coming, you prepare in advance. Same goes for our nation's future. Things seem calm right now, so it's the perfect time to prepare for the next big crisis. That's why we recommend stocking up on emergency food from My Patriot Supply. They're America's #1 preparedness company with millions of happy, well-prepared customers. Their food lasts for up to 25 years in storage. It's an insurance policy you can eat when you need it. It will be there. And right now, you can save $50 on a 4-week emergency food kit. This kit provides breakfast, lunch, dinner, drinks, and snacks, totaling over 2,000 calories a day. Every family member should have one of these. So go to preparewithdaz.com and save $50 on your 4-week food kit.
All right, so who would have thought that this whole entire situation of C-19 would be getting linked to sleep paralysis? I'll put a link in the description box. Regular consistent sleep patterns have taken a serious hit since COVID-19 entered all our lives around 2 years ago. Ever-changing rules and restrictions, working from home, and quarantining are among the various factors that have taken their toll on many people's sleep ability to enjoy a good night's sleep. Reports of sleep paralysis are now emerging on social media, with some speculating that it could be a symptom of the new Omicron variant that has infected record numbers of people, according to The Express. It admits that the sensation can be scary for anyone who experiences it, but adds that it is harmless and that most people will only get it once or twice in their life. The NHS website says people experiencing sleep paralysis can feel like someone is in their room or as if something is pushing them down, and the feeling can last up to several minutes. It is currently unknown for certain what causes sleep paralysis, but it has been linked with insomnia, disrupted sleep patterns due to things like shift work or jet lag, narcolepsy, post-traumatic stress disorder, general anxiety disorder, panic disorder, family history of sleep paralysis. Reports on social media of people experiencing sleep paralysis after catching COVID have caused some to speculate that the two could be linked, although such link has not been established by research yet. One study has, however, identified a marked rise in sleep disturbances among patients in quarantine. It suggests that sleep paralysis could be a side effect of the pandemic and the societal changes it has caused, rather being caused by COVID itself. Sleep therapy expert Dr. Kat Letterly told Mail Online it could be the virus infection itself impacts on sleep regulation in the brain. Neurological effects of COVID have been reported. I think it is more likely that should there be an increase in sleep paralysis, that this is due to stress resulting from the big changes to how we go and live our lives at the moment, the uncertainty and anxiety that we are facing, which are impacting on our sleep system. Night sweats and vivid nightmares. The expert reports Catherine Pinkman, NHS consultant and founder of the Insomnia Clinic, as explaining how sleep paralysis can be caused by disrupted sleep patterns. She said once our sleep pattern becomes disrupted due to ill health or anxiety, then we get stuck in a cycle where we begin to associate bed with being awake. For example, the longer we spend in bed tossing and turning, unable to sleep, the more we begin to relate our bed to being awake. Equally, the more hypervigilant and anxious we become about sleep, the worse the cycle gets. Sleep paralysis is linked to sleep deprivation, so that we go some way in explaining why COVID and sleep paralysis are linked. Reports of other night-related upsets have also emerged since coronavirus swept the world in 2020. An increase in night sweats and vivid nightmares, for example, have been reported. So that is it for the article, but I just wanted to share it because sleep paralysis, as many of you know, I used to suffer from it a lot when I was a teenager into my early 20s, and I always saw it as spiritual, even though I understand that sleep deprivation, insomnia can lead to it, but the experience itself is. And I do think that with COVID being out there, in a way, everything is spiritual, and the fact that so many more people are experiencing it means that we're experiencing more of a spiritual shift. And there is growing anxiety. There is a mass existential crisis. This is why anxiety in general, stress levels are rising. And I want to know, for anyone who knows anyone who has been positive for COVID, or just in general, you don't have to have had COVID, have you noticed more sleep paralysis lately in your life or people you know's lives? For me, I haven't really been experiencing it much, despite my insomnia. I haven't had COVID before, but I'm just asking, what is your experiences with it? And what do you think about this link? Thank you for tuning in, everyone. I hope you have a wonderful rest of your day. I'll talk to you in tomorrow night's live stream at 8 p.m. Central Standard Time. In the meantime, take care. Have a wonderful rest of your week. God bless.